the truth is, where you practice is important. It's a detail. It's important. And there's often the perspective that I couldn't do this in my town. Like, for example, that doctor in Seattle that I described in the earlier question, that if you're practicing in Seattle, you might think, I could never do it here because of these 4 dominant employers. Maybe the best example I have of that, Naren, is pre-COVID. I was speaking at a San Jose Dental Society sponsored course. And I was talking about the 6 steps to successfully drop PPO plans. And a doctor came up to me at the break, and he looked to be in his late 50s, maybe even 60 years old. And he said, Gary, I just wanted to thank you for coming to San Jose and sharing your information with us. I have not stopped taking notes since you started. And he said, the only thing is I'm a little frustrated that I won't be able to do this in my practice, but I'm finding all kinds of things that I can apply. And I said, well, where do you practice? He said, Sunnyvale. Well, I happen to know Sunnyvale pretty well. It's up in the peninsula area, and Sunnyvale is known as a tech hub where major tech companies are located, including Apple, Microsoft, and many other tech companies. And his practice is in Sunnyvale. And he said, Gary, I don't think I can do this here because of the dominance of these, all my patients work for these tech companies that provide them with PPO plans. And I said, well, where do you live? He said, well, I also live in Sunnyvale. And then I said, we had talked about one of the keys to going out of network successfully is to attract people who don't have insurance. So I said, Doc, let me take a minute and ask you some questions. I said, are there any retirees in Sunnyvale? Because we were talking about, let's find people that don't have insurance. And he said, sure. He said, many of my neighbors in my immediate neighborhood are people like myself, either at or near retirement age. He said, it's not like Florida or Arizona or South Texas, but yeah, we have a lot of retirees. So, okay. I said, how about millennials? Do you have any millennials in Sunnyvale? He said, yeah. He had a kind of good sense of humor, and he said, yeah, they're easy to find because they're in the basement of the retirees. And we laughed at that. But he said, yeah, we have millennials. Remember, millennials often don't have insurance because they're so early in their career that they haven't reached a point where they get benefits. And there's a third group, Doc. I said, are there any gig economy workers in Sunnyvale? Those are independent contractors, freelancers. A lot of them work in tech. Some of them are Uber drivers, Lyft drivers, Etsy shop owners, VRBOers, Airbnbers. And he said, oh my goodness. He said, my community is a hub for gig economy workers. And all of a sudden his eyes got really, he said, wait a minute. You're telling me I can do this here. And I said, think about it. And anyway, I use that as an example because even in an area that seems like the odds are against you because of the dominance of major employers, it's not everybody in the community. And anyway, that started him changing his perspective on, I won't be able to do this here. That, wait a minute, I could do this here. So yes, you can do this in your town. Now, some of you might think, well, I'm in a very competitive area. Well, we're in Phoenix, Arizona. I don't know that there's a more competitive area than Phoenix, Arizona. So yes, you can do this in your town.